At the Mental Health Foundation, we aren't just funding programs. We're transforming how mental health and addiction care are delivered across Alberta. As a foundation, our role is to be a thoughtful, evidence-driven leader that turns provincial strategy into local impact.
We're dealing with human beings who happen to have a mental illness, which is a continuing care illness, just like diabetes, just like other chronic rheumatological diseases that we have. Mental illness is no different.
I would like to see mental health be destigmatized and certainly incorporated into an understanding, people showing empathy, but also showing real actions and a commitment to getting involved with mental health.
We need to talk about it, and we need to not feel scared in talking about it, and we need to not feel stigmatized in talking about it.
In an extremely confusing and disjointed system, what we're trying to do with the Mental Health Foundation is be that light at the end of the tunnel.
What we promised somebody for their future is that they won't have to continue to jump from door to door or from hoop to hoop to find a solution or a treatment that works for them.
One of the things they're really investing in is Kickstand, which is a low barrier to no barrier service, and that is available to everyone across the province. So I think that's one of the ways they're really, pushing the envelope.
No wrong doors means that when a young person reaches out for help, they shouldn't have to hit a dead end when they're in that state. Kickstand really does this well by offering a virtual and physical in-person option for young people to walk in.
You need to go where the people are. You need to recognize that sometimes the very nature of their mental illness or mental challenge prevents them from help seeking, right?
The one thing that the Mental Health Foundation provides is its role as a connector, putting together the different resources to amplify the results and provide people with a logical pathway and a system that makes sense in a time of crisis.
We invest in the gaps where care is often fragmented. By focusing on rigorous research, improving patient outcomes, and connecting rural and Indigenous pathways, we're building a system that treats people with the dignity they deserve.
There's nothing more meaningful than seeing your responsibility as a board turn into a compassion for a person. And so when you can see somebody actually doing better, you know that you've put donor money to good use.
What I would like to see is that there's a real shift in mental health and approach to mental health, a shift towards that mental health does matter.
Because at the end of the day, this isn't about statistics, it's about people. It's about our neighbors, our colleagues, and our families. We do this because we know that in Alberta, we all know someone.
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 We all know someone.